Community-acquired pneumonia for medical students. Community-acquired pneumonia is a common and potentially serious respiratory infection acquired outside of healthcare settings. The bacteria usually involved is Streptococcus pneumonia, which is the most common causative agent, but other bacteria such as Haemophilus influenzae and other atypical pathogens like Mycoplasma pneumonia and Chlamydophila pneumonia are also frequent. The common symptoms like fever, cough, productive sputum, chest pain, and shortness of breath are usually present. On physical examination, crackles, bronchial breath sounds, and dullness to the percussion may be observed. Based on the symptoms, physical examinations, and the risk factor, a clinical diagnosis can be made. Chest imaging, such as chest X-ray, is commonly used to confirm the diagnosis and assess the extent of lung involvement. Usually we see the lobar consolidations. It is usually involved to a single lobe. Blood culture, sputum cultures, respiratory viral panels may aid in identifying the causative agent. The severity assessment. It could be assessed by a score which we commonly known as the Curb 65 score. It evaluates the severity of pneumonia based on the confusion, urea, respiratory rate, blood pressure, and age. Pneumonia Severity Index (PSI), which assesses the risk of mortality and helps guide the level of care needed. The selection of the antibiotic depends on the likely pathogen and the severity. Common choices include macrolides, fluoroquinolones, or beta-lactam antibiotics. Oxygen therapy, it is administered based on the oxygen saturation levels. Treatment is often initially empirical with adjustments made on the culture and sensitivity results. Tailoring therapy based on the patient characteristics such as age and underlying health condition should be considered. The respiratory failure is one of the complications. Severe cases may progress to respiratory failure, necessitating the advanced support. Pleural effusion is another complication. Accumulation of fluid in the pleural space may occur. Vaccination encourage the influenza and pneumococcal vaccination, especially in high-risk population, is a good preventive method. Regular assessment of clinical response to the treatment, vital signs, and resolution of the symptoms are used as monitoring for follow-up visits. Addressing and managing any complications that may rise during the course of illness as a complication management. Advising on hand hygiene, avoiding close contact with sick individuals, and seeking prompt medical attention from the respiratory for the respiratory symptoms is a patient education what you can provide during the discharge. Thank you.